Hi everyone, Dr. Hall, continuing on with abortion. So we've just talked about the history of abortion and that throughout most of human history it has been legal and accessible, but starting in the late 1800s it was criminalized or made illegal. And so what about nowadays? So abortion today. Well, so Roe versus Wade was the 1973 decision by the Supreme Court that said that a woman's right to abortion was protected by the 9th and 14th Amendments, which are the right to privacy and to personal liberty, right, and control over your own life and body. It also has to be balanced against the state's interests, which do include a protection of prenatal life, but also protection of the woman's health. And in the first trimester, abortion is much safer than going on to full term and giving birth, which, as we know, is a potentially risky endeavor. And abortion must, according to Roe versus Wade, be legal before fetal viability, which is usually somewhere between 24 and 28 weeks. So remember when we talked about fetal development and babies who are born prematurely, there is almost 0% survival if you get much below 24 weeks. And at 24 weeks, it's still pretty low in terms of survival, but some of them do survive. 28 weeks, many of those fetuses will survive. Many of those preemie babies will survive, but they may have some medical problems as a result of being born so prematurely. So that's what the 1973 Roe versus Wade Supreme Court decision said, is abortion needs to be legal. But states are allowed to regulate them in a variety of ways. And so that's where things get rather interesting. So, some states have kind of tried to do things along this line, right? So if they have lawmakers who believe that abortion should be illegal, right? Things like, oh, you just have a 9-month waiting period. You can definitely get one, but yeah. So it's a joke, right? But it's not entirely without some basis. So Texas has been pretty active in a variety of measures to try to outlaw, actually, abortion in their state. So a couple of years ago, they passed a law saying that if you're an abortion provider, you have to have admitting privileges at nearby hospitals. So to explain what that means, so I'm a physician, right? And I work at the Student Health Center. I work at the clinic. I see patients. I put in IUDs. I do stitches. I treat sprained ankles, all those types of things. I do not have admitting privileges at our local community hospital. I do not do hospital medicine anymore. I used to earlier in my career. You probably wouldn't want me doing hospital medicine because it's been so long, and that's really not what I specialize in. So the folks who passed this law said, well, it's really important because if something goes wrong with an abortion, then and somebody requires hospitalization, that doctor needs to be able to take care of their patient. This is actually kind of a false argument, right? So my patients sometimes need hospitalization, and when they do, a hospital doctor takes care of them. It doesn't need to be me, right? Even if I botch an IUD insertion and I perforate somebody's uterus, I am not the doctor that's then going to take care of that problem. I don't have the training and expertise, right? So I'm going to consult and refer them to somebody who can take care of that properly. So the opponents of this law said it was done merely to make it more difficult for abortion providers and to reduce women's access. And in fact, that is what happened as a result of this law. Many of these abortion providers did not have hospital privileges, were not even qualified to get hospital privileges because they didn't do hospital medicine. That wasn't their specialty. So many clinics closed in the state, more than half of them. They went from 42 to 19, and they did see fewer abortions performed in their state overall. Interestingly, it only decreased by 13%. So what that means is the existing clinics got busier. Although more than 50% decrease in clinics, only 13% decrease in the number of abortions. And the states that border Texas actually saw increases in their abortion rates. So it looks like people just kind of went elsewhere, Or, as you'll see in this next bullet point, they had to wait longer because the existing clinics were busier. They also saw an increase in at-home and self-induced abortion, so things that we heard about in the documentary that you just watched. So the Supreme Court declared in June 2016 that this law was an undue burden and that it actually was not resulting in improved safety for the women, and so it got struck down. This is not the only law like this. There are many that are happening all the time. So last year in April, a 6-week abortion ban called the Heartbeat Bill was signed into law by the Ohio governor. And said that you can't do an abortion once a fetal heartbeat can be detected, right? Which is sometimes so early in the pregnancy, depending on what you actually call a heart, right? If it's a tubular structure that beats, then yeah, that could be a heart, absolutely, right? It can. But so they passed this ban, but of course that conflicted with Roe versus Wade. So a federal judge said, no, you can't do that. You need to protect the right of a woman to access abortion until fetal viability. And, a 5 or 6 week, 3 or 4 week embryo is not capable of living outside the womb, so does not qualify. Then last fall, right, they proposed a total ban on abortion. So we'll see this again and again. States keep passing laws to try to outlaw abortion, either at some earlier stage of the pregnancy or outright. This has happened in Nebraska and North Dakota. All kinds of states have been passing laws like this. Texas actually has just halted abortion services due to the coronavirus outbreak. So they've said it is not a medically necessary procedure, and so therefore the abortion clinics had to be shut down. So they basically made it impossible to get an abortion in the state of Texas right now, unless it is medically necessary to protect the mother's life. So if she has severe preeclampsia or something and it's too early for them to just do a premature delivery of the infant, if it's way early, then if there's other severe medical problems, then they can do it, but only if it's necessary to preserve the life or health of the mother. So this has been a big issue, and so we're seeing the same types of things, right? So clinics are having to close, people are doing more self-induced miscarriages or abortions, and here's a story from this young woman who is a single mother of 2 that just after losing her job because of coronavirus, she found out she was pregnant, called the local abortion clinic, and of course she's finding that it's closed. She can't get an abortion in Texas anymore currently, and so she drove 350 miles to Kansas to get an abortion, which is certainly not what we want people doing during a pandemic, is to be traveling all over the place. And of course it was a big hardship for her. As a single mom with 2 kids, I can't imagine having to do that. Now, certainly if you're someone who feels that abortion is immoral and wrong and should be illegal anyway, then you might not have any sympathy for this situation, and I totally get that. So you might wonder why states keep passing these laws that violate the decision from Roe versus Wade, because then they all get struck down in the courts. And the reason is because we've been changing during our current White House administration, changing the staffing of who the judges are on those courts. And so many people in these states who want to make abortion illegal, they feel really strongly about it. They want to pass a law, get it to a court where the judge will say, you know what, I think this law should be allowed to stand, knowing that then it will be challenged again, but in the hopes that that case will eventually work its way all the way up to the Supreme Court, and that perhaps the Supreme Court might overturn Roe versus Wade. And so many states have passed laws that if Roe versus Wade were to be overturned by the Supreme Court, that would functionally ban abortion in those states. So there are a lot of these legislative efforts happening to try to make abortion illegal. Sorry, I had a little technical difficulty there. So you might be wondering what's the status of Wisconsin. So Wisconsin does allow for abortion. There are some restrictions, as we'll talk about in a moment. There are only 7 abortion clinics in the state of Wisconsin. The closest to us geographically is in Madison. So most people from our area that need an abortion go to the Twin Cities in Minnesota instead. So the restrictions that Wisconsin has placed on abortion is that you must receive state-mandated counseling that is specifically designed to discourage you from having the abortion. And then you have to have a waiting period of 24 hours, right, to kind of think about it and make sure that this is the decision you want to go through with. This is very challenging for a lot of people because this means you have to go to the clinic one day to get your counseling, and then you have to come back again the next day to get the procedure itself. So if you are someone who has to take time off of work to do that, right, that is very difficult. You must also have an ultrasound exam, and the provider has to show and describe the image to you. This is also purposefully designed to discourage somebody from choosing abortion. If you're under age 18, your parents have to consent, which is unusual. And I understand the reasons for it, but there's also a lot of reasons against. And state health insurance plans do not cover abortion in Wisconsin. So as a state employee, if I wanted to have an abortion, I would have to pay for that out of pocket unless my life was in danger or it was due to rape or incest. And then finally, abortions in the state of Wisconsin can only be provided up to 20 weeks after fertilization, so 22 weeks by your menstrual calendar, unless the woman's life is in danger. This distinction, which is earlier than fetal viability, was made because of a hypothesis that a fetus might be able to feel pain at 20 weeks. Our best scientific evidence shows it probably doesn't develop until 25 to 26 weeks. It doesn't seem that the nerve pathways actually exist before 25 to 26 weeks. So this is earlier than we think they can actually feel pain, but that was why they chose that timing. So abortion today is legal and safe for now. Right? It's still controversial. Lots of people believe a zygote or an embryo or a fetus is a person, and then understandably feel that you should not be allowed to end that life. Abortion can be really difficult to access because you might need to go far away from where you live, and you might need to go on 2 separate days, right? Take time off of work and travel potentially great distances. And the cost averages anywhere from about $300 to $800 for most abortions. So a word about funding for abortions. Let's talk about how they get paid for. We already talked about the fact that state health insurance will not pay for it. Most private health insurances will also not pay for abortion. So for most people, it's going to be out of pocket. So I want to talk about Planned Parenthood, because whenever we talk about abortion, people always talk about Planned Parenthood. So you might remember Planned Parenthood was founded by Margaret Sanger to allow women to plan when they had their children. So initially she started teaching women how to use diaphragms, and then she was part of the movement to invent and bring to market the birth control pill. And so Planned Parenthood's primary mission is actually to provide contraception, to provide birth control to people. And so this was so important, as we learned, for women's ability to get an education, to participate in the economy, to work outside the home, to be able to plan when they were and if they were having children, that federal funding to help support Planned Parenthood through Title X was actually started by President Nixon, who is a Republican hero, right? We don't necessarily think that a Republican would support Planned Parenthood, but he did, because this was really important that women had access to birth control, right? So his quote here, "No American woman should be denied access to family planning assistance because of her economic condition," right? We want to make birth control available to everybody, no matter what their income or financial status is. So Planned Parenthood clinics have historically provided free or low-cost birth control to anyone who needs it. So let's take a look. I apologize, this is blurry. So this is kind of a pie chart that shows you what types of health services Planned Parenthood provides currently. And so more than a third of what they do is provide birth control, consistent with their initial mission. They also have become a major reproductive health provider, and so they do a lot of STI testing and treatment. So that's the other third of what they do. They also have increasingly become primary health care and reproductive health care for female-bodied people primarily, but also men. And so they also do a lot of cancer screening and prevention work. So things like pap smears, and which we'll talk about when we talk about STIs, and mammograms. They also do some primary care, so prescribing thyroid hormone for people with hypothyroidism and lots of other general primary care services. So when you look at abortion, which is a service provided by Planned Parenthood, abortion services make up about 3% of all the services that they provide. So when people talk about defunding Planned Parenthood, you have to realize that abortion is a very small piece of what they do. It may be a piece to which you object, but it is a very small piece of what they do. In fact, you could argue that a lot of what they do is prevent the need for abortions in the first place. So a little bit more news, right? So this was really interesting. So I found this graphic a couple of years ago, and it was saying, you know, we shouldn't be funding Planned Parenthood because yes, all they do cancer screening and prevention, they've actually decreased how much of that they do, and they've actually increased the number of abortions that they do. So therefore, we shouldn't be giving them any federal funding. So the source for this is Americans United for Life, which is an anti-abortion group. And so I want to draw your attention to a few things that they're doing with the data to kind of manipulate it and make their argument appear stronger than it is. Not that they have zero argument, but let me just show you a couple things. One is that the scale for these is not the same. So if you look at cancer screening and prevention, it was 2 million, okay, which is way larger than 327,000. So first we need to acknowledge that these things are on a very different scale. The other thing that I want to point out is that the guidelines for pap smears changed between 2006 and 2013. So pap smears are some of the primary cancer screening that Planned Parenthood does, and the recommendations changed from doing them every single year to doing them every 3 years. So if they were following the recommendations, the number of pap smears they did should have gone down by about 2/3. So this decrease in cancer screenings is actually showing that they are following best medical practice. They shouldn't be doing as many pap smears because the guidelines changed. So if we were to put these things into a graph that allowed for a direct comparison, it would look more like this. So yes, we have seen a significant decrease in cancer screening because of changes in guidelines, not because they're not interested in providing those services. There was, during this period of time, a relatively small increase in the number of abortions that were done, right? It's measurable for sure, but relatively small. And as you can see, is a very small proportion of all the services provided. Contraception went down a little bit. Part of the reason is because we switched from forms of birth control that require annual visits to lots of forms of birth control that require visits only 3 years or every 5 years, right, with the implant and the IUD. So those have become more popular. People didn't need to come in as often for birth control visits. So we would expect that decline. And we can see that their STI testing and treatment actually has increased significantly, by 25% from 3 million to over 4 million. So yes, Planned Parenthood provides abortions. Yes, they do. But we need to keep in mind that it is a small portion of the services that they provide. Additionally, we have a law called the Hyde Amendment, which prevents federal funding of abortion. right? So even though there had been federal funding of Planned Parenthood until fairly recently, we'll talk about that in a minute, none of those federal dollars could ever go toward abortion. Abortion has to be funded separately at Planned Parenthood through fees that the women pay to get the service and also private donations. So that's how abortion services at Planned Parenthood are provided. So Title X, I alluded to this earlier, that's that federal funding program. It provides funding for clinics for reproductive health services in general. And so Planned Parenthood has been one of the largest recipients of this federal Title X funding because they have been the largest provider of reproductive health services in this country. So you can see in general, Title X funds have provided, 700,000 pap smears, over 1 million breast exams, 4 million STI tests, and then also a lot of birth control and contraception. So in 2019, so last summer, our current White House added a new rule to the Title X funding that a lot of people call a gag rule because it prohibits recipients of Title X funding from referring any patients for an abortion or giving them information about where they can get one. So if you had a patient who came to you with an unintended pregnancy, you could not tell them where they could get an abortion. You could tell them where they could go for adoption or pregnancy-related care, but you couldn't talk to them about the option of adoption. It also said if you were a clinic who also currently provided abortions, you had to create a completely separate clinic for that. You had to build a new separate clinic. The other thing, which is prohibitive cost-wise, the other thing, and this is one of the things that bothers me actually, is that it all bothers me, but this one is problematic, I think. It bothers me because this is a legal service, right? So I don't understand why we're imposing certain religious views over others when it comes to governmental funding. So that's my own personal bias. There you go. All right, but this one, clinics are no longer required to provide all effective methods of contraception. So it used to be that if you received Title X funding, you had to offer the full suite of contraceptive options, everything from birth control pills to condoms to implants to IUDs, so that the person seeking birth control really had all of the options available to them and could choose what was best for them. You might wonder why they would include this, and this comes to that lingering residual idea that IUDs cause abortions, which, as we've discussed, they don't. They don't interfere with implantation of a fertilized egg. They prevent fertilization from happening in the first place. So it especially bothers me because it's based on a misconception on how those work. All right, rant over. So because of this new rule, right, most Title X sites have said they can't accept these funds anymore, including most Planned Parenthood clinics. So we no longer have federal funding for lots of our reproductive health care in this country. So this is the current state of abortion in our country. We have legal, safe abortion available in all of the states except for Texas and some other states right now who during the pandemic have said it's not an essential medical service. But there are restrictions even in places where it is legal, such as waiting periods, mandatory counseling designed to discourage you, parental notification for minors, those types of things, and not being able to use your insurance to pay for it. So we're going to pick up next and talk a little bit about, in part C, about unintentional pregnancy, because especially as we think about defunding these clinics who've been providing birth control, we have to worry about what the impact of that may be, perhaps unintended consequences.